So the moving target of COVID-19 has made it extremely difficult to prepare for any kind of nationwide local government election. This is as the trajectory of the pandemic in the country is not entirely predictable, and every wave is different from its predecessor, for lack of a better term. Voter turnout could be severely affected on election day when some municipalities experience higher infections than others. So let's hear from our two guests who made submissions at the Moseneke Inquiry on holding free and fair elections during a pandemic. Dr. Abdullah is an infectious disease clinician at the Steve Biko Hospital. Michael Beaumont is with Action SA, in fact, is the chairperson for that political organization. To both our guests, thanks very much indeed for your time. It's lovely to have you on the program. Dr. Abdullah, I wonder if I can start with you. It appears now, given what Moseneke had to say about his report, that the elections in February hinge largely on our vaccination drive. Would you say that's a fair summation of where we are?
That's exactly right, Ayanda, and good morning to you and Michael. If we are able to vaccinate enough people, that shows a decline in mortality and hospital admissions, whilst the cases are going up in the fourth wave, then we are on a slightly better footing to have an election than we are if we were to go ahead in October.
Interesting that that is the case, because what we know about vaccines is that they don't stop the virus from spreading. We also know that if the virus continues to spread, there may very well be a variant that is in the mix by February. How much of a consideration do you think that is as we lead up to that date?
Well, I think, the variants create a lot of uncertainty moving forward. And, we've just had the experience of being completely overrun by the Delta variant, which was much more transmissible, led to an enormous third wave in Gauteng, which thankfully is starting to turn now. But to answer your question, it matters less what variants there are and what vaccines we use, because all the vaccines seem to have the same effect, which is to decrease severe disease, hospital admissions, and mortality. So, whatever the variants, whatever the vaccines we use, the most important thing really is that we get enough coverage to see that decline in mortality. And we'll have the opportunity in the fourth wave. If we vaccinate 300,000 people a day from now for the next 3 to 4 months, we should see that effect in the fourth wave. If we don't see that effect, we're back to the drawing board on this issue. We'll have another Moseneke Inquiry.
And I wonder if we can afford to do that. I'm not talking about monetary sense. I'm actually talking about whether or not our Constitution can afford that. But, Michael, perhaps that's a good place to bring you in. I mean, Action SA has spoken about the balance between the right to vote and the right to life in the past. Do you think this particular report struck the right balance?
I think it did, Ayanda, and good morning to you and Dr. Abdullah. I think it was a difficult task, and I think Justice Moseneke, threaded that needle very effectively. I think our position more is that it should never have come to this point, because there are two factors that brought us to the position where a constitutional choice had to be made between the right to vote and the right to life. And we are deeply concerned about there having to be a choice in a constitutional democracy where both of those rights should be protected. And the reason why this choice had to be made was essentially twofold. One, we are an under-vaccinated population. So as Dr. Abdullah points out, had we gone to elections with the current levels of vaccinations, in all probability would have put great stress on our hospital system. But at the same time, there is a fundamental lack of confidence that South Africans can vote safely. And that is a function of how the IEC has been led in this process rather than leading itself.
There was also a lot said about smaller parties being particularly disadvantaged in the event that the election does go ahead. I mean, now that we're eyeing February as our objective, do you think that particular concern is adequately addressed? I mean, for all intents and purposes, we'll still be in a pandemic even at that stage.
Absolutely. And Ayanda, I'm actually quite critical of this idea that political parties are this unique entity in the world where every other organization has to adapt to a so-called new normal. Businesses and NGOs, everyone has to do things differently, right down to the family unit. And for some reason, politicians think that they are special. and that they should, have to be devoid of these kind of changes and adaptations. I think the reality is the conversation cannot be led about what is convenient for political parties. It has to be led by the weighty issues of our democracy and the health of our population.
I mean, Dr. Abdullah, if we can bring you back in this discussion, I mean, it's not often that we get science and politics intersecting in this way. I guess many will be relieved that it appears that the voices from the scientists were heard and were responded to even in this report.
Yes, I think that's very encouraging that Justice Moseneke, used the information that we provided to him, which were, so these decisions are based on facts. And I think it's a good start to postpone the elections, because just going ahead would have been, I think, quite a risky, risky decision that would have potentially cost lives. So it's a good start, but, it all depends. I mean, the pressure is on the health department now to get that vaccination up and running, at 300,000 vaccinations a day. That's where we want to be, and we should be able to see the impact of that if we're able to achieve that. Having said that, I think it's also important that on the one hand we open up to everybody over the age of 35, which is a very good decision because it addresses the demand side issues in this vaccination rollout. At the same time, within that, we do need to focus on the over 60s and those with comorbidities, because that's where the mortality is generated from. Those are the people who get sick and die. So we do need to focus on that. If we can get those two things right in the vaccination rollout, then it's very possible that we could get away with an election as proposed.
Part of your submission to the report itself, or the inquiry at least, was also noting how the epidemic may be different in different municipalities. I can't seem to remember from the top of my head if that was actually mentioned, at least in the media report given out yesterday. Do you get a sense that that complexity has been appreciated, even if we do postpone the elections to February?
Well, yes and no. In the first instance, Justice Moseneke took that idea on board comprehensively when he decided that an election in October was unsafe. Because, as we speak now, the Northern Cape is coming down in its infection rate. Gauteng has just turned. Other provinces like the Northwest and the Western Cape are still on the increase. So I think he took that into account. And by October, we would have seen different provinces at different stages of the fourth wave. Having said that, there's no reason why that shouldn't be the case in February. So we need to keep our eye on those interprovincial variations, differences in the municipalities, to make sure that there isn't a province or two or a municipality or two which is in the peak of its fourth wave. But yet again, the protection against that is a resoundingly successful vaccination rollout. So everybody should put its focus on that, especially over the next 3 to 4 months.
Sure. Michael, of course, the consideration now for political parties will be modes of electioneering that still consider the public health concerns that we're in. I mean, February is thought of as the end date, but that's not when election mode actually begins. You and I will agree that it's probably way earlier than that. As a party yourself, I mean, how are you thinking around those kind of issues even from now?
Yeah, well, I mean, electioneering has really started for us a while ago. So it's really about political parties being responsible in the manner in which they do things. So I'll give you the example, Yanda, that a few weeks ago we had our candidate elections where we invited members of the public to vote for our candidates for local government, much like the primary system does in the United States. And we had over 20,000 votes cast in that process. And yet there was no spike of infections that arose from that. And that's purely because we took all the right precautions. And the Moseneke report, Justice Moseneke's report, actually refers to electoral studies around the world last year, of which there were well over 100 and 170, where elections took place in many of these countries successfully, where there wasn't a spike of infections because the adequate measures were taken to protect the electorate.
We might very well find ourselves in a context where some kind of electioneering also needs to take place in December, where the national mood changes. Again, nothing is ever the same after COVID-19, but I mean, how are you thinking about specifically that moment, which in South African culture is not really that politicized? I mean, people usually go on holiday and feel like sitting back. I mean, what kind of questions are you exploring in the face of us possibly having to be in the throes of electioneering in December in South Africa?
Well, I think from our perspective, we're in a race to make sure that we reach as many people as we can and offer our message to as many South Africans as we possibly can. But I think the point you make is a good one, and that kind of final part of December, the final 2 weeks of December, is a period of time where South Africans don't really want to hear about politics, quite understandably, given what politics has done to them for the remainder of the year. And I think, really it's a case of just making sure in that time that political parties regroup so that when everyone returns in January, there's no doubt going to be a very concentrated, high-intensity level of campaigning for the remaining 7 to 8 weeks before the election day itself.
Yeah. Dr. Abdullah, final word from you. Other countries have taken part in elections. We've seen the consequence of that. What lessons do you think lie, for us at least, in the context where, again, COVID may still very well be with us by February?
Yeah, I'd like to agree completely here with Michael, and that is that the political parties do need to come to the party, excuse the tautology there, but they need to understand how to do electioneering safely, because as you said, that fourth wave is likely to be in December and January at its most intense. So, we can't afford to have every election rally, every election meeting, every door-to-door campaign to be a super spreader event. That would just be a horrendous fourth wave. So the parties do need to get, on top of all sorts of kind of digital methods of voting and electioneering, but also the social distancing. And here lies the rub, right? This is the problem, is that if government enforces it in a tough way, then it will be seen as the ruling party, wanting to prevent other people from electioneering freely. So the government also needs to be very good about making sure that it's not seen as biased or as trying to influence the outcome of the election through its interventions. And target territory here, it's tricky business.
Yeah.
But unless we actually get to a situation where the political parties do understand that they have an equal and a big responsibility to make sure that they do their electioneering in a safe way. And then on election day itself, just the IEC's thousands and thousands of employees, they need to make sure that they are safe, they do things properly. My view is this story is not over yet. I think that there are going to be so many twists and turns, and so, we better be able to keep an open mind, think about what actually happens, and closer to the time, be able to just make sure that we continue to do the right thing, as Justice Moseneke is trying to do.
Absolutely. Tell you what, in the midst of all this disagreement, I think we'll all agree that the decision makers have an unenviable task. To both our guests, thanks very much indeed for your time. Really do appreciate it. Dr. Farid Abdullah is an infectious diseases clinician at Steve Biko Academic Hospital. Joining us there is also Michael Beaumont. He's the chairperson for Action SA. Once again, thanks very much indeed.